acceptance and commitment therapy, we believe that that approach, in theory, works by supporting people in increasing what we call their psychological flexibility skills. And by that, I mean being able to just notice what shows up in their life and then taking the wisest and most values consistent action in response to that. So basically choosing how we're going to respond rather than being flung around like a worm on a fishing hook, whenever fear shows up. And then cognitive behavioral therapy is designed to work by supporting survivors in identifying those sticky thoughts that just keep showing up for them, and then looking at those thoughts a little bit more critically. So a thought like, I would never be able to handle it if my cancer recurred. We supported survivors in thinking it through, like, what would you do if your cancer recurred? What were 3 steps that you could take if your cancer does recur? Well, I would get back in touch with my oncologist. I would follow, evidence-based treatment guidelines. I would get the support that I need. I would take really good care of my body. So survivors were able to see that they were not going to be powerless if their cancer recurred. And I think that was really helpful, giving people a little bit more sense of confidence that, what, I wouldn't like it if my cancer recurred, but I would find my way through it. The survivorship coaching, we think that worked, could have worked by, helping survivors to get really focused on something that was meaningful to them and then taking specific action. So really, when you think about all 3 of these programs, the one common factor across all of these is we were trying to give survivors tools and resources that they could use to improve their quality of life and to manage that fear whenever it shows up.